the idea was that, well, when a contract gets to the contracting team, it should happen quick. But that's not the case when it gets to contracting. So we found that being a part of those conversations up front with the departments, with our customers and end users, along with the vendors, and being there from the start, by the time the contract gets to us, we have also worked several other things in tandem before it even got to our desk.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
Today on Power Supply, we will talk with Kelly Huffer, Senior Contract Negotiator at UVA Health, and she has a great success story. She's been a listener of the podcast, and she reached out and said, would you guys like to have a guest on the show to talk about getting technology adoption, specifically around her role, which is contracts and value analysis processes? And what she's going to tell us today is not only how to leverage benefits of technology to improve that, make it more efficient, but also how to make the case so that you can open up room in a budget that didn't already exist to adopt similar technologies to improve the supply chain operations in your organization. Hayes, how great is it to have a guest listen to the show and then ask to come on? And she's been a podcaster before.
Agreed, and she's good at it. So you better come and listen to her, and you're going to learn something about the problem she solved and how she's doing it. And so it was a wonderful episode. So come and listen.
We'll be right back with Kelly Huffer, Senior Contract Negotiator at UVA Health.
Bam. I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Speaking with us now is Kelly Huffer, Senior Contract Negotiator at UVA Health, and we're going to be talking about gaining C-level support for mainstreaming contracting and value analysis processes with technology. And so, I got to say, technology is like one of those things where you hear lots of conversations about it. Everybody knows they need it. And yet somehow it also becomes one of the most difficult things to bring into your organizations. And that's what Kelly's here to talk to us about today, is how can we be successful with this? And so, Kelly, you reached out to us because you're a listener of the podcast. I'm so glad you did. And I want to welcome you to the show with Hayes and I today.
Well, thank you for having me. I really appreciate it. Yes, I've been listening to your podcast for, I would say, several months now. And I have to say that this platform that you all have is incredible. And what you're doing in this space is exactly what we need, especially in value analysis and contracting, because we don't get to venture out very often to see what other people are doing. We're at home base a lot. And so hearing from your guests, what they're doing, what works, what doesn't work, has been so helpful, I know, to me in my role, and bringing those into our department as well.
Well, Kelly, I appreciate you saying that, and we love to talk to you, people who listen. But I don't want to put you on the spot or anything, but do you have a favorite on the show other than Gary?
Gary's not here.
I know, so it couldn't be Gary. There's no way it can be Gary.
I can't answer that.
Okay.
I feel like if I was one-sided, we might have to end the show.
we have this running battle. I think we've let this out before on a couple other episodes over the years, but we keep a tally of every time we ask a question and one of the guests says, "That's a great question." And we keep a tally. And at the end, we're like the winners, whoever got the most great questions, comments. And so anyway, we've got a healthy competitive nature amongst us hosts here on the podcast. And I actually want to kind of take what you just said and use that as an opportunity to encourage other listeners to come forth and offer themselves up and some of their insights or projects that they've been working on as success stories like you did in reaching out to us on LinkedIn. I just want to encourage others to do the same, because it's exactly what you just said. It's hearing from other people who are doing the job every single day and what works, what doesn't work, maybe some pitfalls or strategies, or even just keeping your eye on, maybe what's coming on the horizon, that I think makes this, so much fun. And, I often have people ask me, well, what do you want me to talk about? And so this is actually an area where we don't dictate the topic. We find good guests and we want them to talk about what they're passionate about. So if you coming on helps encourage anybody else to share their insights, I figured we'd take a moment and acknowledge that. And so you've been brave enough to come forward, and this is going to be a great conversation today. And we don't bite, right?
I hope not. So far it's been pretty good. Good conversation so far. We'll find out, though.
Well, again, Gary's not here, so it'd probably be a very pleasant conversation. So I just want to get that off. But again, we appreciate you being here. And again, to Justin's point, it's great to hear, from the people that are actually doing the work. And so we're excited about this.
Kelly, why don't you start by just telling us about your role at the organization and any relevant prior experiences that, you want to talk about too.
Yeah. So I am a senior contract negotiator here at UVA Health, and I started in this role in December of 2021. Peak COVID. So a great time to start. I started at UVA almost 10 years ago at the front door as a patient advocate in the emergency department. Kind of worked my way through trying to figure out what I wanted to do. Wasn't sure what the goal was, but I loved healthcare and I loved patients. And when I transitioned into administration for neurosciences and project management, that I started wondering, where are these supplies coming from? How do they get here? Who's responsible for this? And when I started looking into that, I felt like I had opened the door to another world. And I found supply chain and value analysis. And around that time, I saw a job opening for a senior contract negotiator. And I thought, well, why not? So I threw my hat in the ring, and we have a wonderful administrator and director who gave me an opportunity. Clearly, they saw something in me because they opened the door and let me in, and hope they don't regret it. But here I am.
That patient advocacy work is really to be commended too, because you work for the organization, but you're advocating for the patient, which is a good thing. But it is sort of weird being a teammate. And then maybe there are times where you feel like the patient deserved a little bit more. And so you're trying to help them get it, or maybe they're just not communicating their needs really well. And you're making sure that gets communicated over. But I've always did your organization consider that sort of like part of the clinical team or part of the care team? Because to me, you're basically the same thing as a nurse or a CNA or, lab tech, anybody who is providing patient care.
We're considered partners to the clinical team. While we're not clinically treating the patient, our goal is to make sure the patient's getting the best care possible and to help express their needs and their maybe dislikes every now and then to the clinical team.
I mean, what a great background that you had. But when you went over to supply chain, it had to be quite different because you were seeing a whole different part of the organization kind of behind the door, right?
Yes, I think of it as like the Wizard of Oz. It's the machine behind the curtain. It's
Yeah.
a whole other world.
It's like at Disney, you walk through the park one afternoon, the next day you come back and all the flowers are different and everything's changed. You're like, how did that happen? Well, they do it overnight behind the scenes. So, which is kind of what you were experiencing, I'm sure.
Oh, yeah. And in supply chain, getting to understand the products and the supplies that are brought in and knowing where they're coming from and who's supplying them and how do we get best pricing and what do our clinicians want, what do our physicians want. And that is understanding that. I consider that patient care as well, because we're trying to find what's not only best for the patient, but what's best for the organization as well.
Yeah, it's interesting. We've had a lot of conversations already this season about just connecting, manufacturers and the supply chain to the patient experience. And you came into the role with the patient experience. So, do you find that there are coworkers that kind of lean on you for that too? And sort of like wondering maybe if they haven't had their own patient experience, what that's like, or asking you to kind of talk a little bit about, the other roles that you've had at UVA?
Well, we have a really diverse group of contract negotiators at UVA. Most of us have some sort of clinical background, but then there are others who don't. And so we do have those discussions about how does patient care directly relate to what we're doing today. And opening up those conversations is, you share some wonderful stories, but you also share the crazy ones too. I think that with the diverse backgrounds from outside of patient care, also within patient care, I think that it creates a lot of strengths in our department.
Yeah, it sounds like you're very well-rounded, which is important to bring all those different perspectives and experiences to the table. I don't know a better way to segue into our technology piece other than to say you kind of reached out to us and said, we were managing contracts, in one way, and we identified a need to utilize technology to do this better. So maybe you could just describe, how are you managing contracts before you leverage the technology? And then we can maybe walk through the process of getting that technology approved, and then we can look at the benefits of that.
Absolutely. So when I started in 21, there were two senior contract negotiators in value analysis, strategic sourcing. And when we were brought on, we were designated specific departments to work their contracts and execute them. And the situation was sort of like, this is how it was before, so you have the freedom to figure it out and make it better. And I cannot express enough how thankful I am for that type of leadership, allowing us to evolve and to progress. So when we started with the two of us, how we were receiving contracts were through either a purchasing system or emails. I even received hard paper contracts. It wasn't organized. There wasn't a standard process. And so with those contracts, the way we were receiving them, there was also no background or information about what is this contract for other than what it read on the paper. And as any other negotiator who reads contracts, you need a little bit more meat than just what it says on the paper, a little bit more context. And so as we were getting an idea of what contracting was in our system, we were also bringing on other negotiators as well. And we decided that we need to figure out how to organize this, how to streamline this across the system. And so at that time, we started process mapping our current state. How are we currently expected to work these contracts that are coming in from everywhere? And what do we want that to look like?
Kelly, can I just quickly question around the number of contracts? Can you give me a ballpark of not only med surge, but maybe purchase services, just to kind of, what does that look like?
Yeah, so I work specifically with pharmacy, and at any given time, I can have between 50 and 80 contracts on my desk or in my queue.
So, which is, I mean, virtually impossible to stay on top of them all in a manual process.
Exactly. If there is not an organized intake for those contracts and tracking, not to mention what happens when one of my fellow negotiators goes out on leave, someone's got to pick up that work. How do we do that? And not having it in one platform where we can all have access to it, or even our customers, our pharmacy leadership, our heart and vascular leadership, if they can't see their contracts and process where they are, then things get lost and contracts get dropped.
If you don't have all the terms and everything all laid out, I just don't know how it's even possible.
Yeah, it will get lost so fast. And then if you lose a contract because of how disorganized the system is, then you could lose pricing on products. You could lose access to something. And so that alone is the vital importance of having something organized.
I bet there's some people listening right now are probably going, yeah, I feel her pain. We're in it right now. We don't have any organization here.
Even if you can access it, there's like an amount of time that it takes to access it, depending on how you're storing it too, right? Like I would imagine, even if you have a really great manual process, it still is going to take time to dig up contracts and find what you need, even with the best of manual processes. And so let me ask you, like, as you started to realize that technology was required, like, what were some of the things that were happening? I mean, I know we're speaking really kind of generally, like, oh, I have 50 to 80, it's really hard to keep a handle on it. But like, were there actually like little areas where either the contracting processing was just taking too long? Were there misses in the process where people were like, how could we have missed this? And like, what were the symptoms that you had kind of hit bandwidth on this?
I love that you use the word symptom because there were a lot of them. So when the business owners or customers, clinicians, when our end users were accepting contracts from their vendors, they were receiving them. There were conversations going on behind the scenes between our customers and the vendors about products, about services, software, equipment. And then after those conversations were going on for some time, then we would receive a contract. And by that time, there could have been months that had passed. And so the idea was that, well, when a contract gets to the contracting team, it should happen quick. But that's not the case when it gets to contracting. So we found that being a part of those conversations up front with the departments, with our customers and end users, along with the vendors, and being there from the start, by the time the contract gets to us, we have also worked several other things in tandem before it even got to our desk.
Yeah, this is really about process, right? You needed process controls, you needed like some sort of process management, and you needed continuity, like you said, many months. Even if you'd been copied on an email, how would you have kept it all together? And then to go back and fish that information up to make sure that the contract accurately represented the conversations is probably also just like an extremely tedious process. So, I think it became pretty clear to you that you needed some sort of technology, but just because you realize you need it doesn't mean you get it. And so, you had to go through some sort of an approval process and even support to start, right? Because why spend the time trying to find a solution if you know that in the end, it's not gonna get approved. And so how high did you have to go? Is this a C-level type of decision?
So in 22, our university legal counsel made the decision that we needed a repository for our contracts, an online system where we could store our contracts once completed. So that was immediately brought on to our system. And so all of the contracts that had been completed that were saved in various drives somewhere were dumped into this system. While at the same time, we were still working contracts through email or through some sort of purchase system without any sort of context. So when we decided that we needed something online or some sort of software that could be accessed in the same way as our repository where we store the contracts, then we need to start looking for that to see if it's available. So what I started doing was discussing with my pharmacy leadership, hey, what do you want for your contracts? What would be ideal for you? Would an online system or some sort of software where you could see everything in progress from start to end, what do you think about that? And so we started gathering feedback from our end users because these are their contracts. I heard you all say in a previous episode that contracts is the running back. That's exactly what we are. So,
little shout out to Matt Putman because that was a phenomenal episode. We had the whole football analogy. That's great.
Yeah. So it's their contracts. They are the subject matter experts. What are we doing to help them get these completed? And so receiving their feedback and also looking at where we were in a current state, we helped bridge the gap. Okay, this is what our end users want for their contracts, but at the same time, it would help us be organized. So we're all succeeding. So, but how do we do that? And so that's when we started going on the hunt and identifying software programs or online databases for those services.
I love that you went to the stakeholders that were going to make this work and figured out what they wanted before you started. I mean, I don't know how many different options you might have had in terms of software, but to also make it an efficient process for you on the, kind of procurement or sourcing of that solution, like knowing what was going to be the most helpful ahead of time probably helped you narrow down the field a little bit so that you could take deeper dives sooner and get the right technology kind of determined. What was the major factors, maybe like 3 top factors that led to the solution that you did choose?
Accessibility, number one. Was it easily accessed by our end users? Was it easy to navigate? User friendly. Oh my goodness. These systems can get so complicated, and the last thing we need is for anyone who's involved with patient care is to have another system that's more complicated than it needed to be. And also the ability to see everything live as it is being worked.
You mean almost like a pizza tracker from Domino's? Like you kind of know what stage you're in within the process?
Exactly. I want that when my department is looking for a contract, we're not exchanging 3 and 4 emails trying to figure out where we are and what's outstanding. I want when they log in, they can see exactly the last thing I've done to this contract and what I'm waiting on so that we don't have to go through phone calls, text messages, any of that. They can go and see it anytime.
All right. So once you finally settled on a solution, you kind of got everybody in agreement, it's time to implement. And I feel like this is the area that causes so many organizations the largest amount of pause. It's like, how is this implementation going to go? You were just talking about it, ease of use, et cetera, and there's like a lot of internal stakeholders that are probably going to have accounts, and it's going to change the fundamental way that we do procurement and how we bring, not new, medications in your case into the facility or into the health system at large. And so, you might even have multiple users from multiple different sites. And so, implementation just becomes this like thing that I think a lot of times is the bottleneck In the end, it's like you mentioned, oh, when it gets to contracting, everybody expected it to go through really quick. Well, once you have that solved as a technology, I feel like implementation is the new bottleneck, right? Because a lot of people get impacted and it creates some hesitancy around timing, et cetera. So how did you set up for a successful implementation so you could, get to using the benefits of the technology sooner rather than later?
I went to my department leadership, pharmacy, heart and vascular. I went to their leadership and asked, hey, can we use your department as a guinea pig for our pilot? and that's what we did. But I would have to say that we narrowed it down to where we don't have everyone in the department with access to this system. We needed key stakeholders that could make contractual decisions to have access. So we started meeting with our departments, our designated departments that were signing up to be the piloted departments for this system. And with pharmacy, I started having a regular cadence with them. And they practiced submitting a contract and practice tracking the contract, while at the same time, I am implementing for myself how to work the contract from this system. And so we're both learning, myself and my end users, on how to use the system. We're meeting on a regular cadence to find out what's working, what's not working, what can we get rid of, what do they wish they could see when they're looking at this system? They don't want to see a whole bunch of words and random things going on here. They want to see the immediate. Where are we at? And so we started building a rapport with each other and having this regular cadence of process improvement. And so we piloted this across a couple different departments for several months before we started piloting then with other departments and expanding our reach with their contracts as well.
Let me ask this question. From when you decided you're going to go find a solution for this to when you actually purchased it, roughly how long was that? Then the second part of that question is, okay, now we have the solution. When did you start seeing some benefit? When did it make your life a little easier? Because obviously there's a lot of steps, false steps there when you start. But when did you actually start getting some ROI?
So the first part to that question, we identified a solution before we went to leadership with the ask to pay for it. So we sat down and went through a few different systems, looked to see what other healthcare organizations were using as well, and what was working for them, what wasn't working. We met with a few different vendors to have them work through it on like a demo. And so that's how we really narrowed down. Also keeping in mind budget, what do we have to spend before we actually have leadership approve that spend? Can
you say roughly how much?
It really depends on how many contracts an organization is processing. A lot of these systems are based on your contract number. So if you have an organization that is processing about maybe 500 contracts a year, and then you have another organization where we're processing around a couple thousand a year, the type of system and the cost of it is going to vary tremendously.
So once you've implemented the product, have you already started seeing the benefits already?
Absolutely. So with this system, we were able to identify expiring contracts up front. And that is something that we did not have eyes on prior. When are contracts coming up for renewal? And so getting ahead of those, because this system also works with our repository, and getting ahead and creating reports of this contract's coming up for expiration so that we don't miss out on contract pricing or lose access. And then we're also able to look back in real time at our negotiations for pricing. How much were we able to save last renewal of this contract or last execution of this agreement? What can we use now towards this? What was our benchmarking prior? What is it now? we're able to pull all of that in real time and start getting ahead of contracts before they're due for renewal, before we lose pricing, and have a better bird's eye view of what's moving through. As far as time, I would say that I started noticing ROI on this within months.
That's fantastic.
Yeah, I was just going to say, like, what's great about the tool is it's built in ROI. It literally calculates the numbers that were elusive before that you can then attribute to why, you spent the money on it to begin with.
Yeah. I have to say also a really good partner in this system is our value analysts, because we work directly with them and they're also pulling numbers and running benchmarking as well, utilization. And so all of that data can be uploaded with the contract so that you can see everything.
So are you then running your value analysis process through this tool, not just contracting, but like you said, people can see where you're at in the contract. So are you actually engaging in sourcing initiatives in the tool?
So not right now in the tool, but that is something that would be future state.
Well, let's talk about future state. Let's do
it.
Talking about let's go right there. Like all the benefits that you've already gotten. So I'm assuming like a lot of technologies, and again, we're not necessarily talking about your specific one, but I'm interested in your experience as a user, like in terms of, maybe that it's, fully featured, fully powered, but that in the first year, you're never going to use 100% of a robust platform, right? So that's typically why you see a lot of these solutions having different subscription levels. And so it's sort of like, hey, let's get our foundation in place. Let's figure out exactly how we're going to use this, in phase one. And then we're going to build something toward the future. And then you can kind of level up. And what's great is, like you said, you're building an ROI. So if you had new use cases for the future state, you're showing the savings that's justifying the expansion of the utilization. So, is that how this works? Like you said, oh yeah, we can do that in the future with the value analysis piece. Does it have different levels of service and different add-on features that that allows you to grow with the product?
Currently it does, but those are limited. And we have looked into those various modules that you can acquire through money, through an extra subscription. You can add on those extra modules. And I will say that when we brought this on, my goal was to use it until I broke it. What can I do with this system and what can I not do? I need to know immediately up front. And so we started utilizing what we had brought on to the fullest extent. And when we started realizing, we need to add a few different things to this, then we could do that. But it also has a max capacity as to what it can provide to us, even with those other subscriptions.
So what does your immediate, kind of next steps look like? And then, you mentioned future state, like maybe value analysis is something you do in the future. I mean, maybe you leverage a different system for some additional technologies that you plan on bringing in. So maybe I ask this question more in like a roadmap. What can you do with this solution that you plan on doing to continue improvement over the next, couple of years or in the next year? And then, what are some areas of technology adoption that would just make natural sense to continue building on the program?
So currently, we recently just presented to our C-suite at their cabinet meeting the success of this pilot and how we're rolling it out to other departments. And what's important in order to move forward and to progress something like this is to make sure that you're aligned with your C-suite. What are their goals for their departments? What is the institutional goals? How are you helping your C-suite succeed within their teams? Because that's what they want to know. They want to know how are my teams succeeding? And so with implementing something like this, we are helping their team succeed in their contracting, because if they can see their contracts and see their what they're spending in real time, they can also budget more appropriately, because now they have a view on the contract and what it's costing them. And they can also see actively what they're saving. And that's incredible too, because now you're meeting the budget requirements for that year. Where do we need to trim? What can we cut back on? And so having the C-suite's support and trying to implement something like this, whether your organization is smaller or is bigger than UVA, I think that's really important. And so moving forward, we just keep that open dialogue with them. And what do we want to do next? We want to now roll out to the entire system. We also have 3 community health hospitals that we are trying to roll this out to as well, and making sure that you have the buy-in from your end users as well.
You know, it's great when you can have them, like you talked about doing a pilot with the departments that you support, right? Pharmacy, and I think you said cath lab, is that right?
Yes.
Yeah. And so they can then talk to their colleagues at the other hospitals and sell them on the benefits, right? And then your location or your group can also talk to other groups and help translate the value so that maybe they're more quick to adopt. Because anything I've learned about in all the presentations that I've seen at different conferences and things like that, and I've been in a couple of workshops on change management, and it's always about getting engagement, and nothing gets you engagement better than, you know, colleagues, you know, talking to you about the benefits that they've already had. It's the hardest when you're just kind of like forcing it top down and like, this is what we're doing. And I'm assuming you've taken that same approach then, obviously, just the way you're describing it to me today.
Yes, we've also had end users or stakeholders come back and say, I don't have time to learn this. I don't want to do this. It's the continual building that rapport with those very important people, because it's their contracts, building that rapport and helping them understand that it's actually going to make their lives a lot easier being able to see this. And so once you get that buy-in, I've noticed those are the key people. They will spread the word real quick about how easy it was, because they were the most resistant to it.
Maybe one last question for me as it relates to the whole process. Once you've got it in, now you're using it, you pilot it, seems to be working well. Would you say your ROI on this thing is 3, 4, 5 times what you paid for it?
We're seeing huge benefits on this. Yes, the savings alone on our contracts from being able to see the whole picture in one platform is incredible.
That's where I was getting with it. I mean, it seems to me that it would pay for itself many times over on that reason right there.
So, Kelly, I just want to congratulate you on, you know, being able to implement technology and not just like, oh, I know we need this, and then kind of like steamrolling your way through to it, or putting it on that capital budget purchase year over year until it finally gets approved. Making the business case to the business, you know, kind of decision makers, stakeholders, et cetera, is great, but nothing is worse than advocating for an improvement and then having it flop because you don't engage the stakeholders, because you know the next time you go back and make a case for another technology adoption, you're going to be less likely to get it, because it's all about building trust. And so you really understood that when you got into this process. It's clear as we talk through it that you didn't just make the business case up front, but then you did a great job of getting, you know, all of the stakeholders to get on board and realize the benefits, so that as you want to expand on leveraging technology, that you're more likely to be able to do it. And you're going to have all of these champions like you were just talking about that are going to be like, oh, you've got more? Great, show me. And they're going to be way more open to it the next go around when you reach out to them and say, oh, you thought that was good? Well, wait till I show you this. And you can really build some change momentum within your organization. Is there anything else you want to add before we wrap up? Is there a piece that we're missing that we really have to get out to that audience before we close?
I think that something that we touched on, but I don't know if it's emphasized enough, is the partnership between supply chain and our frontline nurses, doctors, stakeholders. I think that is something that I have seen missing prior, but we have really been trucking forward with that relationship here at UVA, and it has created a wonderful partnership for the end user and supply chain.
Excellent. What a success story. And, Kelly, thank you for being an example to others who might want to come on the show and talk about the great things that they're doing at their organizations and how to accomplish some of these projects like this. And I want to thank you for being such a loyal listener too over the last couple of months, because you even shouted out a prior episode with specifics. Like, that's great. We love it. And so just encouraging others out there to come on the show just the same as you have would be great.
Well, I appreciate it too, Kelly. It was wonderful. I know you didn't say that, I was your favorite, but you definitely said that Gary wasn't. So we appreciate you being a dedicated listener, and thanks for hopping on here with us today.
Thank you all for having me. I really appreciate the opportunity.
That was Kelly Huffer, Senior Contract Negotiator at UVA Health. And we're talking about how you get support for mainstreaming contracting and value analysis processes by adopting a technology. Hayes, I thought she did a wonderful job. Clear and obvious opportunity to improve efficiency and get some savings, but also I love the fact that the solution itself tracks the ROI, so you can go back pretty quick and say, look, this is how much we've, saved on our contracts year over year. And we might not have really been able to report as well on this, especially in aggregate, if we didn't have a tool like this, never mind the operational efficiencies that, she and her team have been able to yield from having electronic processing. I can't believe she said she was getting literally paper documents. It sounded like in the mail, not even just fax, but literally in the mail.
Snail mail was sitting there. Well, I suspect there are a lot of guys and gals out there that are in the same identical boat that she was, trying to manage all this stuff and spreadsheets and emails and everywhere else. Got to do it the way they did. You got to go to the contract management. And clearly, even offline, she talked about some of the savings. It's pretty dramatic. So wonderful, wonderful show. She brought up and highlighted something that a lot of people are working with or working on. And so I really enjoyed it. It was a good job.
Yeah, and making that case for adoption. So I'm sure Kelly's on LinkedIn. Big believer in networking. That's why she reached out to come onto the show. I'm sure she'd love for you to reach out to her on LinkedIn as well and maybe pick her brain if you need to put together a, kind of proof of concept or make a case for similar technology adoption in your organization. And too bad Gary wasn't here. He would have loved this episode, Hayes.
I tell you, Gary, yeah, he would have loved it. But you know what? He either doesn't know how to use the calendar. I don't know. He's from Idaho. I'm not so sure, but he would have enjoyed it. He is on the road, but he would have enjoyed it for sure. So, but he missed it. It's his problem.
All right. Well, on behalf of Hayes and myself, thanks for listening to this episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.